The Economic Survey 2025-26, tabled in Parliament on January 29th, has identified digital addiction as a significant and a growing public health and mental concern in India, especially among children and youth. With internet access nearly universal and smartphone use pervasive, the issue has shifted from one of the access to one affecting behavior, well-being and productivity. Excessive screen time and online use are linked to anxiety, depression, low self-esteem, sleep disruption, distraction in academic or work impairment. Gaming disorder, compulsive scrolling and social media overuse are contributing to social withdrawal and emotional distress. The shift comes in the context of India's booming digital economy. Internet connections have grown from 25 crore in 2014 to nearly 97 crore in 24, and digital services now account for a significant share of the national income. The survey emphasizes that while digital access has fueled economic growth and connectivity, compulsive and high-intensity use impose real social and economic cost if left unchecked. Rather than punitive bans, the economic survey lays out multi-layered preventive and behavioral health-focused measures to mitigate digital addictions and its impact. Suggestion number 1 is age-based access control and platform safeguards. The survey urges the government to consider age restrictions on social media and digital platforms for minors, along with stricter age verification, default safeguards, and limits on autoplay and targeted advertising. This is to protect younger users from addictive content exposure. Suggestion number 2, digital wellness and education. It supports introducing digital wellness curricula in schools and colleges, teaching screen time literacy, cyber safety, and health online habits. This aims to equip young people with skills to manage digital engagement responsibly. Suggestion number 3, parental and community interventions. The survey highlights the need for parental training on screen time management and community programs that promote offline activities, mentorship, and peer support to counter compulsive digital use. 4, mental health support systems. Recognizing that digital addiction overlaps with mental health issues, the survey recommends expanding the Tele-Manas helpline beyond crisis response to actively address behavioral addiction with greater integration into school systems and more trained counselors. Suggestion number 5, network level and device level safeguards. It suggests technological safeguards such as differentiated data plans prioritizing educational content, default blocking of high-risk categories, family plan controls with guardian overrides, and promotion of simpler or education-only devices for children. The survey situates digital addiction alongside other modern public health challenges such as obesity and diabetes, stressing that behavioral health risks can undermine human capital just as much as physical ailments. Meanwhile, countries that have banned social media include Australia, which has banned social media for under 16, France for under 15, and Denmark for under 15 with parental exemptions for those 13 and above. In fact, Indian actor Sonu Sood today requested the Prime Minister to impose a ban on social media for children under 16 and make it a national movement. Experts and policymakers now debate how best to translate these recommendations to policy and regulation. While there is global momentum for age-based digital limits and platform accountability, the economic survey emphasizes balance and education rather than outright bans, aiming to preserve the benefits of the digital economy with, while reducing its harm. I'm joined by Dr. Mimansa Singh Tanwar, clinical psychologist and head of Fortis School of Mental Health Program. Good evening. Your opening comments on digital addiction, madam?
I think it's a welcome step with what the government is passing on with the regulations. Working in the space of school mental health for now close to 15 years and more, I do believe that a lot of these suggestions that have been shared, we have been talking about how media literacy need to be a part of the school curriculum. It's something that has been required for a very, very long time, and finally it has been acknowledged is something that we must, take as a positive step in the right direction. It's just the fact that I think everybody needs to do what they need to do. So where parents need to do what they need to do, and parents have also been struggling in this space for a very long time. We do get a lot of parents and kids with social media challenges, addictions, and it impacting their mental health, and so many other aspects of their life in our clinical setting as well. But at the same time, I think what certainly we require is a lot of psychoeducation in this space. We give and we use mobile phones a lot earlier in age without having any means of how we can go about it, neither in the form of literacy nor in the form of awareness. Even as adults, I think what we end up doing is a lot many times, what children tend to imitate. So passing on, messages without even checking the credibility of those
Dr.
messages.
Mimamsa, do you think that this mobile phone can actually deliver, if I have to add everything, this whole thing of instant gratification, it's a doorway to porn, food porn, satiating your impulses immediately, connecting you with the things you desire, but disconnecting you from the people who are there. You can be in your own world despite being surrounded by people. As someone who understands human mind, as a clinical psychologist, is this a split in a way the humans as species have evolved?
Instant gratification, yes. And we also need to understand that the way social media, websites, and a lot of these things that are used for the consumers also has a lot of psychological aspects that they tap on. So the doom scrolling aspect, of course, has a very impulse satiating kind of an approach to it. We keep doing it. In a similar way, the attention span, if you look at, from a 30-second reel to a 15-second reel to now our attention span, we just want to see something for a couple of seconds and then we just want to move on to the next. So it's slowly and steadily, in a very subtle and subliminal way, begins to change our behavior, where we don't even recognize how, in terms of our actions, it's bringing in that change.
How can it mentally affect you? I know you lose your productivity. You will waste a lot of time scrolling things. I understand that in terms of work, but how does it mentally affect you?
See, when you go on social media, there is a lot of comparison that we end up making. There are likes and comments, posts, shares, so many things that young people, and not only just young people, but even adults, we look for that. There is a need for validation, social validation, that has sort of spiked up within us because of what we are trying to look for from the audience outside. And
adolescence?
Yeah.
Adolescence? Social validation?
I would say both, even adults for that matter. We feel that we know how to manage it better, but more so difficult for adolescents. Absolutely, there is no doubt about that. But we can't also deny the fact that it has an impact on the adults as well. And which is why I'm saying that adults need to role model it better for kids and adolescents to be able to take again the right measures. Unless we don't take and approach it in the right way, kids learn from us and they won't be able to learn it the better way if we don't model it. So yes, whether it's likes, shares, comments, whether it is the challenges, the trends, the visibility aspect, the viralability aspect that we end up following, and we conform to it. There is a conformity element, and specifically for young people to be a part of the larger norm of what is happening. They want to be a part of it.
Okay.
So there is an element of conformity that happens over here. And that is the reason why you see that there are trends that become so popular. There are challenges that young people tend to follow.
Okay. Thank you. Thank you. I've really run short of time, but I'm very happy that, a document like Economic Survey of India has taken into cognizance such an important social issues which affect everyone, every family.